Hello, hello, good morning. Happy Mental Health Monday. Happy Monday, good morning. Happy Monday, everyone. Welcome back for another week, another day, another Monday, same month to continue talking about how to take care of our mental health. Remember, guys, for this month and for the rest of the year, I am going to be focused on children's mental health. However, I start with the disorder. And I actually start with a neurodevelopmental disorder that actually impacting children's mental health. So last week, we spoke about ADHD. And this week, we're going to continue staying in the neurodevelopmental issues or disorders that's normally impacting children. So before we continue with the subject that we have for today, two things. First, I wanted to thank all of you guys who subscribe to the channel, who share, who like, who comment. Thank you so much, because the more activity that happen in this channel and in this video, the more someone can find this channel. We do need, the more people that find this channel, the more that I can do. Of course, right? I can bring people, the more people that I can also help, right? So I want to thank all of you guys who's doing that. Second thing, you guys know, before I start talking about the topic that we have, I always encouraging you guys, and I always stop right here and ask you guys, what do you do last week to take care of your mental health? What did you do? What did you do last week to take care of your mental health? While you guys are thinking, I want to share with you guys what I did last week to take care of my mental health. You guys, but for me, I have a hard time forgiving myself. I have a hard time. It's easy for me to forgive people. Sometimes some things people do to me go over my head. I'm one of those people who don't really blame or keep people in my heart or have enemies of people, because, and honestly, I truly believe we all are doing the best that we can do in this earth, and it's not about me. So I don't take things personal when people do. And then sometimes it go over my head. Sometimes I'm like, this is you. They do them. So I need to go accordingly. Like, let's say if someone step on my toes, that's them stepping on my toes. I need to act accordingly. I can say, hey, ouch, you step on my toes, or I make sure I don't stay around that person who can step in my toes. So, you can do what you need to do. So forgiving people, easy for me. But forgive myself, I have such a hard time to do. But this last week, I sit down and I'm practicing of forgiving myself. I am journaling, certain things that little Krista did, like little Krista of 16, when she was 16, that does. And then I'm still holding on to those things. Little things that, even little things Krista did last month. That was Krista back then. I need to learn how to forgive that Krista. The Krista that was 30 years old, that was dumb and stupid. I need to forgive that. And that is something I am practicing, self-forgiveness. So that's something I did last week. I sit down, I write things that stay in my heart, that stay in my mind, that I keep going over and, robbing my joy, robbing my present, because I cannot forgive myself. So I take the time to do that. I take the time to forgive myself. That's what I did last week to take care of my mental health. What about you guys? What did you guys do last week to take care of your mental health? Like, I encouraging you guys, the way you get up, you brush your teeth, you do your hair, you change your underwear, you change your clothes, you do different things, you eat. I do encouraging you guys to practice things daily, weekly, monthly, every hour, to continue taking care of your mental health, because your mental health is also health as well. So let's keep going. So like I mentioned, I am still under the umbrella of our neurodevelopmental disorder for children. So this week, today, I come with another topic, another subject. Another one that I see that is very popular now, that I'm seeing a lot of kids are being diagnosed with that. It is autism. So, as you guys probably know, there's autism spectrum disorder. So under the spectrum, we see autism, and I'll go over certain other things that's under the spectrum. So when we are saying a spectrum, I always see a spectrum as a rainbow. So the rainbow have different colors, but when you're looking at the different colors, there's some colors that's very faded, and there's some colors that's very bright. So that's how you can see a spectrum. A spectrum is like a rainbow. There's thing that's mild, there's thing that's moderate, and there's thing that's severe. So autism, it's one of the severe in the spectrum. But under the spectrum of autism, we see Asperger, we see autism, we see childhood disintegrated disorder, as well as some other developmental disorder. So it's like those four major things that we do see under the spectrum. That's why now you see a lot of people that saying, oh, I'm quite sure that I'm under the spectrum, because there's certain things that doesn't get developing in our brain. And then there's certain things that you see the people is not integrating with, right? So like I said, there's Asperger, autism, childhood integrated disorder, as well as other developmental disorder that we see under the autism spectrum disorder. But today we are going to be focused on the autism part of it. So the autism disorder, what is that? Autism disorder is one of the neurodevelopmental disorder that's impacted children social, communication, and emotion skills, which mean, and when I'm saying neurodevelopmental, which mean it's a brain issues, and in the brain the child doesn't developing those three major things: the social part of it, the communication part of it, as well as the emotional part of it. So those three parts, it's not developing as common. And I say common because what's normal, right? So as common. And autism, we can see it as early as 9 months old. But most kids diagnosed with autism between 18 months to 24 months. We see it happen more on boys than girls. It doesn't mean some girls cannot be autistic. It's just that we see it happen more in boys. I think in United States, the statistic now, it's 1 to 4 times more in boys. And we are seeing a lot of autism diagnosed this day. I think now it's 1 in 4 in United States. We are seeing a lot of it. Since this moment, there's some signs that saying we believe is genetic. It is very likely if there's someone in the family that is autistic, you will see some other people autistic. I know in my family there's autism. I have a little brother that is autistic. I have a nephew that is autistic, and I also have a cousin that I am suspected that is autistic. So sometime when you are seeing in the family, you seeing it. It's not unlikely to see a mom having an autistic kid, and then they see another brother, a sibling that is autistic, or that's actually in the spectrum of autism. So they might not be autism, but you might see them Asperger or other developmental issues. Another cause of autism, it's the environment. And what I mean by environment, sometimes, like I know for my mom, she mentioned when she was carrying my brother, it was very chaotic. At that time, there was so much going on in Haiti. There was a president that's overthrown, In Haiti, there was a lot going on, and she's taking care of 3 children. She's pregnant. She was very anxious, very sad, like a lot of things going on. So sometimes that, if you are carrying and you are carrying a lot going on, sometimes we see if the mom are using drugs or poverty, or they are, like, there's a lot going on for that mom while they're carrying that baby. We see the kids can come out autistic. I know some people is saying like certain age, like if you are older pregnant woman, they might be most likely autistic. We haven't studied that as much, so that's not something that I'm going to mention because there's no science behind it. I know some people say a certain vaccine can cause autism. There's no science behind any vaccine that is causing children autistic. Like I mentioned, there is a spectrum of autism. There's some people that is mild. There's certain people, certain area we see. Like for example, the Asperger, we see it affect more social. And then there's kids that it affect more emotional. And there's certain kids that affect more communication. It doesn't mean if a kids have autism that they won't be able to speak. They might fall into the social part of it or the emotional part of it, but they speak well. It also doesn't mean that if a kid is autism, they might not be able to learn. We see some kids fall into the gifted, like there's certain things they are very smart about, and then there's certain things they are not very smart about. So with autism, there's different level. There's 3 level of autism, which is from mild to severe. So we see level 1, we see level 2, and we see level 3. And in level 1, there might be mild, moderation, severe. In level 2, we might see mild, moderation, severe. In level 3, we might see mild, moderation, severe. Some early sign that you can see for kids who is autism is, one of the signs that I see it a lot is speech. That kids can struggle with this speech. Sometimes they have some speech delay. You can see them repeating words. They're doing a lot of repetition. Sometimes you can see the hand flapping, or sometimes they're all over the place. They almost look like ADHD. So they're very hyper. They're very inattentive. They're very impulsive. Sometimes you see the eye contact. They're not looking at you when they're speaking. Sometimes you see them repeating a lot of what they're seeing or what they hear, especially if they watch a show or if they watch a movie or a song. They keep talking about it, but they're not talking to you about it. They're just talking about it. Sometimes you can see the kids are lining like they be lining their toys, they be lining their clothes, they be lining they be lining something. Some early sign we can see, it's like they're having difficulty to comprehension certain things. Like we see some kids have a hard time to potty train. We see some kids having a hard time to knowing people's name. Like they will say like she, they, like they're having a hard time comprehension certain things. And then you will see them don't have a hard time comprehension in certain things, but in certain things they're having a hard time with. Some early sign you can say is that kid is not interested in people. Like they're not interested in the parents, like what the parents is doing. Like they're not interested in copying the parents. If you're calling their names, they're not interested in it. They're not interested in spending time with other kids around their age. They don't play with the kids. They like playing alone. If like kids, let's say like if you have something in your hands, the kids want to see what's in your hand. They want to pay attention. If you have something in your mouth, you will say like, babe, like very early age, if you're chewing, you can see that baby is looking in your mouth and trying to see like what's going on. What are you doing? You will see some kids, they're not interested in that. So those are some early signs you can see. Another early sign that you can see is the emotion. I normally say that those kids have big emotion for small things. Like, like they have big emotion. Like little things that happen. Let's say they can't find their toys. And then they're like in the floor crying, like, acting out or beating. Sometimes they're hitting their head in the wall. They're hitting themselves. Like their emotion is very dysregulated. Or sometimes you can't calm them down. Like if you're trying to calm them down, like if something's happening, you aren't able to. It's like, oh no, they don't want that. Like they have big emotions. Or they're not interested in what you're doing. Some other signs you can see too, it's the censoring sign. Like the kids are afraid of noise. They're afraid of noise. Like you can say, like if you blend or something, they're afraid of that noise. They're covering their ears. Or if you vacuum, they're afraid of that noise. They find things so loud, like the music is so loud, even though they're making big noise. Because sometimes they're making big noise, but they'll find outside noise are very too much. And sometimes too, other sensory, it's texture. Like sometimes they cannot, like some food, they don't like the texture of certain food. They don't like the texture of certain clothes. They don't like the texture. I know my big not my big, he's not my big brother, my little brother. I know he doesn't like the texture of mud. Like, oh my God, if he get dirty, like if his finger get dirty, like he doesn't like it. Like certain texture, they don't like it. Some kids, you might see them very picky eater. And it's like nothing, they don't like nothing. Like certain food, they don't like it. Because they don't like that texture of things. If you suspected your child is autism, best way to go about it is to go to his primary physician, to his pediatrician. And then they will ask you a few questions. They will ask you a few questions to see if that primary physician is suspected autism. Sometimes they can call a consult. They can ask you to get a consultation from anyone in mental health, or they can encourage you or even refer that child to get evaluation. So once that child evaluated, they will let you know what level they are. They will let you know first if they are in the autism spectrum and what happened, where are they. They will tell you if they are autism, and then they will tell you different level. And depending on the level, they will give you a recommendation. Like they will tell you what is that child name. Now there is a lot of resources. There is a lot of help out there. Some treatment, autism, it's not curable, it's treatable. There's some kids that fall in the spectrum with therapy, sometimes a little medication, sometimes certain school can assist as well. Challenging some structure, some routine, some lifestyle change, you can see that child get better. But that child is not curable. If they are in the spectrum, they will be in the spectrum for the rest of their life. So, certain medication they prescribe your child for psychiatric services, it's not to cure the autism. Sometimes it's because of certain symptoms. There's some kids that their mood is all over the place. They are very aggressive. So some of them might need a low dose of medication to calm them down. But it's not something that's doing anything in their brain that's making them developing. Another type of therapy that they provide, it's the ABA therapy. That stands for Applied Behavior Analysis Therapy, that work with children. And they are normally at home. They are very hands-on type of therapy that kids can see that therapy every day for a couple of hours just to start working on certain behavior pattern. Certain other therapy a child with autistic can have, it's speech therapy to work on their communication skills if they have issues with that. Another type of therapy, it's occupational therapy to work in their motor skills, like certain sensory things. Occupational therapy worked on. Another type of therapy, it's physical therapy. A lot of kids get some type of physical therapy to work on their motor skill, gross motor skills, especially when they are young. I see music therapy. It's also work really well with certain kids that's in the spectrum. So another type of therapy, sometimes kids have regular behavior therapy. Sometimes kids have regular mental health therapy, cognitive therapy. Again, certain therapy can work with. I know when I came in, I am a licensed clinical social work. I do not provide ABA therapy, which is applied behavior analysis therapy. But I work with autistic kids, and I'm the other type of therapy, because remember, sometimes there's social skills and there's certain type of social skills that I can help the child with. Sometimes some communication skills that I'm teaching kids with. Certain things, even the emotion, how to regulate the emotion that I'm teaching. And sometimes I work hand in hand with the ABA therapy, or with the speech therapy, or with the occupational therapy, with the physical therapy, or with the psychiatrist therapy. Sometimes I am not enough, because I will come in once a week for an hour. So that's why the ABA therapy and the other therapy needed, because sometimes those type of therapy is twice a week, or they have a group. There's a lot of schools now. There's even autism school that you can send your child to. There's school that do the evaluation, which is the IEP, which stands for Individual Educational Program for the kids. There's RBT under the ABA therapy, which is the one-on-one that will go to the child's school to be with the child. So there's a lot of services. Some of those kids can be reported to the state of Florida to state that they do have a disability, and then they end up getting long-term care insurance, so they can continue getting some of the services they need. Some kids can be funded with Social Security Disability Fund to help, because some of those kids, sometimes they need extra support. Some kids, now I hear some kids are doing really well with weighted vest, where it can help them, soothing them, keep them calm, helping them with sleep. So there's a lot of resources nowadays. Speak with your primary physician, speak with clinicians, speak with therapists, because the earlier you provide your child with all those type of services, the better. So I'm encouraging you, parent, if your kids diagnosed with in the spectrum, or they diagnosed with autism, I know it's hard. I know it's heartbreaking. I know, but get out in denial, anger, bargaining, depression fast. Because if you remain those things, if you are denial, if you stay in bargaining, you're staying in anger, you do not get into acceptance where you can come and show up for your child. And I am asking you, do not treat your child like they are dumb, they are stupid, there's things they can't do. I find a lot of mom, especially mom, but I find a lot of parents just like, they're acting like this kid is like the less you challenge your child, the less they will do. You cannot be like, oh yeah, they just, they're disabled. Yeah, they're so disabled. And then you treat them like babies. The more you treat them like babies, the more they don't developing. But the more you challenge them, the more you showing them, the more you allow them to be independent, the better. Okay? This is where we're going to stop our video. We always stop our video with a dose of self-care. So we are going to read our dose of self-care for today. Today, our dose of self-care says, remember, you can bounce back from setback. Remember, you can bounce back from setback. I know a lot of time we're thinking that when we have a setback, that this is it. But I am here to tell you, you can always bounce back. Remember the story of Job. Job lost everything that he possessed, wife, children, his things, and he was able to bounce back. Remember, you can't bounce back from a setback. Have a great Monday, you guys. Have a great week. I will see you guys next time. So much, you guys, for listening to me today. Thank you so much for everything you guys have been doing for me with this channel. Have a great Monday, you guys. Have a great week. I will see you guys next time. Bye-bye.